Hey guys, good afternoon. Good afternoon. Guys, how many people would know what I'm talking about if I say physician's assistant? Um, I wouldn't have until a few months ago. I was talking to a colleague and her son got injured and he went to the hospital and he was looked after by a physician's assistant or a PA. But the person at the time introduced themselves as a PA, which is the right thing to do, right? So the reason why I'm talking about it now is the other day I was watching an interview on one of the television stations, and it was in regards to a young lady. She wasn't feeling very well, and like most of us, she booked an appointment to see her GP. But it turned out that the person she saw wasn't a GP, and she wasn't made aware of this because she thought she was seeing a doctor. Um, they gave her some medication and she went home. This was said by her parents. They were giving the interview. Um, she went home and didn't feel any better, and sadly, she's not here with us anymore. During the interview, our parents said um, her illness was very serious. She should have been sent to the hospital. But because I'm guessing the PA is not that experienced and didn't seek the advice of a senior member of the team, um, she was misdiagnosed. And don't get me wrong, patients are also misdiagnosed by doctors. But I'm guessing it hurt that little bit more if you find out that your daughter who was gravely ill was misdiagnosed by a PA when they are supposed to be working alongside GP, getting final decisions and getting advice from a GP, but or a doctor, but they're not doing that. They're taking things to the next level and making these decisions all by themselves. Um, I was looking online and I saw. I'm not saying this information is 100% right or correct, but I saw that a theatre nurse or a practical nurse has more qualification than a PA, along with a degree. It said online they are trained for another 2 years, and for each of these 2 years they do 46 to 48 weeks of training, right? And they are being used in other countries. It's not just the UK, but in those other countries, I am not sure if they introduce themselves as doctors or the patient would have known who they're seeing. New Zealand uses them. Um, South Africa, and Germany, and there are other countries as well that use them. But whenever I make an appointment from now on, I'm going to be asking the receptionist, am I seeing a GP or am I seeing a PA? Because I haven't got a problem seeing a PA. But my thing is, I want to know that I'm seeing a PA. I don't want to be told that I'm seeing a doctor, because when I phone my GP office, I don't know that I didn't know that PAs existed. So I wouldn't have asked for one of them. I would have asked to see a GP. And I'm guessing this young lady did the same, because most people don't know that PAs are being used in the role of a doctor. So I think that's something we should question the next time we visit our hospital or our GP surgery, because those are the places that they are being used as doctors.